Hello, this is Dr. Charles Masarski, and thank you for tuning in to Chiropractic Coordination and Balance, Preventing Injury. Coordination and balance prevent injury in many areas of life. This applies to professional and amateur athletes. This was true in the past and in our own times. Coordination and balance are essential to prevent injury in skilled working men and skilled working women. Disturbances in balance and coordination can cause injuries and hamper the performance of musicians, dancers, and other performing artists. This includes amateurs as well as professionals. And of course, balance and coordination are vitally important for magicians and escape artists. The balancing act you see here is quite amazing, but believe it or not, you perform a very similar balancing act in all probability every day of your life. Consider the seemingly simple act of walking. When you put your body weight on one foot and step forward with the other, there is a moment during which you are standing on one leg. For your nervous system to smoothly coordinate the choreography of muscle contraction and relaxation needed for this balancing act in motion, neurological information must be undistorted. Whether you're turning in an Olympic performance or just going for a walk and carrying out your activities of daily living, interference with neurological control of balance and coordination is a risk factor for accident and injury. The chiropractic adjustment is designed to correct joint dysfunction that can cause nerve disturbance. The result of such disturbance can be disruption of incoming and outgoing messages between your brain and your muscles, ligaments, tendons, and joint capsules. These joint dysfunctions are called subluxations. Subluxations can cause distortion of the messages transmitted to or from the brain. Only a slight distortion renders a message incomprehensible. Distorted information due to subluxation can cause the tone of your muscles, ligaments, tendons, and joint capsules to lack coordination. The consequences of this uncoordinated tone can affect many aspects of life. Consider the following message: confusing nonsense, right? Actually, the previous message was only slightly distorted. Each letter was moved one space to the right in the alphabet. For example, UP should be TO. The undistorted message would have read, "To everything, there is a season." Imagine your brain responding to messages from your muscles and joints, even slightly distorted by subluxation. Consider your muscles and joints responding to distorted return messages from your brain. It is reasonable to suppose this situation can increase accident proneness. It is equally reasonable to suppose chiropractic adjustments designed to correct subluxations can decrease accident proneness. A Navy veteran visited our practice after suffering from back pain for 3 weeks. This patient is an avid golfer and played a vigorous game 3 days before the visit. Unfortunately, this further aggravated his back pain, which he now rated at 6 on a 10-point scale, where 10 is the worst pain imaginable. Clearly, he needed to find substantial relief before golf could be resumed. Misalignments in the lower back that cause pain can also cause disturbed sensation from the muscles and joints of the feet. Disturbed sensory signals from the feet can affect balance. The patient was asked to stand on one leg for as long as possible. The test was repeated on the other leg. His single leg balance was extremely poor, 3 seconds on each leg. Both doctor and patient now understood that pain was not his only problem. The veteran's poor balance placed him at risk for future injury due to falls. Chiropractic adjustments were administered to correct misalignments or subluxations in the lower back. 4 days later, the patient returned for follow up. Single leg balance was now 30 seconds on each leg. He rated his pain at a mild 3 and felt he would soon be able to safely return to the sport he enjoyed. Our case was described in an article published in a military news outlet, Stars and Stripes. Doctors of chiropractic do not consider improved balance and coordination following an adjustment to be miraculous. In chiropractic, such beneficial changes are part of an ordinary day in the office. Improved balance and coordination are frequent and unsurprising results of correcting subluxation. With better balance and improved coordination, the patient is expected to be less accident prone. In addition to balance and coordination, attention and reaction time protect you from accidents and injury. Our paper in Asia Pacific Chiropractic Journal described the ways in which chiropractic adjustments protect patients by relieving attention deficit and improving slow reaction time. Accident proneness is an obvious hazard when one's situational awareness becomes foggy. Unfortunately, many people with long COVID suffer from brain fog. The last thing someone with long COVID needs is a worsening of their brain fog due to subluxation. Our patient has published, our practice has published 2 cases of patients whose brain fog was reduced under chiropractic care. Undoubtedly, this rendered them less accident prone. If you found this video informative, please visit our website. There, you will find additional informative videos by clicking on YouTube. You will find helpful articles in our archived newsletters, and you will find our published clinical papers by clicking on About the Doctors. For appointment information, please call 703 938 6441. We are in the Virginia suburbs of Washington, D.C. If you do not live in the Washington, D.C. area, we will try to locate a practitioner close to you. And again, thank you so much for tuning in.